Hi everyone, in this video we are going to be placing some PDO twisted threads as well as placing some very thin filler for this patient in her necklace lines. So we are starting off with 2930 smooth threads. Actually I believe these are 2940, so just a little bit longer to just kind of cause less pokes for this patient and just cover as much surface area as possible. But as you can see, I'm going in at about a 45-degree angle, inserting my thread, and I want to be able to see that needle almost gliding underneath the skin. So as you can see, when I first insert, I tent up slightly just to view my depth. Once I'm happy with my plane in the tissue, I go ahead and advance forward. And as you can see that needle advancing underneath the skin. That's how I know that I'm in an appropriate depth. This is where we're going to see that collagen stimulation. And I am just covering as much surface area as possible. This patient is very young. She still has great skin, but she's starting to notice these lines. They're often referred to as tech neck nowadays, just because a lot of us are sitting at desks, looking down at our computer, looking down at our phones. So patients are seeing these lines earlier and earlier. They can be a little bit genetic as well, just based upon, facial structure. But we're just going in and placing threads just to help boost some collagen and help, prevent this area from getting any worse and help improve it immediately as well when we go in with that filler. But I did quite a few threads there just to kind of, like I said, cover the entire surface area. Now I'm going in with, this is a very thin filler. You can use it for superficial lines. There is no tyndall, so you're not going to see that purpley bluish undertone that you will with many HA fillers. So if you're doing anything superficial, this could be a great product for that. And I am using a ComfortTox syringe. This is 31 gauge, 8 millimeters, so a very small needle. This patient was topically numbed prior as well. And I'm just going in and basically doing serial punctures. Like, I am following all the way across that line. And it's important in necklace lines not to overfill, because right now the patient is laid back, but when she sits up, we want it to look very natural as well. We don't want to have any excess volume in this area. We're just looking to kind of pop out that line and blend it in. I'm not necessarily trying to completely fill it to complete correction. It's also an HA filler. So, and this is in a very mobile area as we, move our head. So this product is not going to stay exactly where I placed it here. It is going to gently kind of spread around throughout this line. So my goal, like I said, is just to blend and provide a little bit of hydration. That HA is going to attract water and help smooth this area as well. So you'll see that we're not completely filling in this line. We're just placing enough to give a smoother appearance. It's also going to look a little lumpy bumpy at first because we are so superficial. But I am going to give it a pretty decent massage, and as this patient moves around, it just goes about her normal daily life and moving her head up and down. Even when she goes back to her desk after this, when she goes back to the office, this product is going to very nicely smooth and integrate into the tissue and give a really beautiful, just natural, soft result. So now I just have a little bit of arnica cream on my gloves, and I'm just giving a very gentle little massage, a little smooth, just to, if there's any bumps that I feel, I can just gently smooth those out. And like I said, this product is going to nicely just accommodate into the skin throughout the healing process.